Some clinics are seeing a spike in flu cases by up to tenfold over the past 2 weeks. Doctors think it could be due to either recent weather changes or a failure to adopt preventive measures like vaccinating regularly or masking up. Bahajjaj with more.
This medical clinic usually sees about 5 to 10 patients with flu per week. Now it has climbed to over 50 a week in just a fortnight. While the clinic does see case fluctuations outside the usual flu season, one of its doctors said the spike was unexpected in its scale and speed.
COVID has sort of died down, so we are no longer up to date with our flu vaccination, and people are no longer doing the safe precaution of wearing a mask and washing their hands. People are becoming more careless and the virus will spread more easily.
Over at Doctor Anywhere, there has also been a spike in cases by up to 40% over the past week or so. This includes its physical and teleconsult services. Its patients are mostly young kids with flu and high fever, and the recent wet weather could possibly have played a part.
With increased rainfall, which we are seeing actually in the past month, during rainfall season, we tend to just go indoor, and that actually increases the crowding and contact rates, and that's where we then are more likely to mix with one another and actually makes it easier for influenza viruses to spread as well.
At Chua Medical Clinic, it has seen up to 20% more patients with influenza, similarly over the past 2 weeks as well.
Usually the elderly and the younger age group are more vulnerable. However, we see this Sec 4 students just after their O-level prelims. The whole class was down with influenza.
The Communicable Diseases Agency says it has seen an uptick in influenza infections since mid-August. However, there's no indication to suggest the infections are more severe than usual. Still, doctors are expecting the number of influenza cases to continue to rise, especially with flu season arriving in the coming months.
So we are, major global travel hub. So we will get both the northern and the southern hemispheres flu affecting Singapore. So this is typically observed between the month of May till September. So we're seeing the tail end of southern hemisphere now. Then we're working towards the next flu season, which is the northern hemisphere flu season. And that is starting October till about March next year, and then usually peaks around December time.
Doctors are advising the public to maintain proper hand hygiene and to mask up in crowded settings. Also, to get themselves vaccinated at least once a year, especially for those more at risk, such as kids and the elderly.